Lawmakers would like to keep the government from forcing you to get a COVID-19 vaccine and even keep some companies from requiring you to have them. Fox 17 News' Rachel Teedy's live at our Capitol with why experts say this is a slippery slope and really what this will mean for the future of the pandemic.
I spoke to people on both sides of the aisle today. People who work in the state capitol, both Republicans and Democrats, say that they agree that a vaccine mandate isn't the way to go. But the rules for specific employers, public or private, differ depending on who you work for.
Do I believe that there would be a cause and effect ripple? Yes.
Representative Vincent Dixie says he has concerns about these Republican-introduced bills because he fears his colleagues across the aisle won't get the vaccine and that constituents will follow their lead.
It is definitely a personal choice, but we definitely need to make sure that the people who deal with the public, who interact on a medical necessity basis, that they do have this vaccine.
2 bills in the Tennessee House and 2 in the state Senate are the focus here. They are identical across each chamber. One preventing a law enforcement agency or government entity forcing you to get the shot. The other making sure that government employees don't have to get the shot to stay employed.
There should not be any coercion on anybody's part to force someone to submit to any kind of medical procedure that they're not won't.
Typically, an assistant professor at Lipscomb says, government employers tend to lean more toward personal freedom since they're more beholden to the Constitution. Private employers, not so much.
Yeah, especially if they are higher risk, something like healthcare, something like retail. They can require their employees to do that.
There is always a religious exemption, she says. Governments in the past have required citizens to get vaccines, and those laws were upheld.
Any private employer has complete discretion, right? Complete discretion to require vaccinations.
Dixie says he hopes people do get the vaccine. Bowling says she wants to have this protective measure in place while governments around the country are figuring out how to handle this.
It's kind of the Wild West when it comes to state legislatures and state employers trying to figure out what to do and how to balance individual rights and public health concerns.
A balance governments have faced for years, but now also factoring in an unprecedented pandemic. Dr. Fauci says we need 75 to 85% of Americans vaccinated to get that herd immunity, and the vaccines have been proven to be 90% effective in preventing COVID-19 symptoms.
More than 330,000 Tennesseans have been vaccinated, but not everyone has had their second dose. Fox 17 News' Harriet Wallace has been monitoring how our state health department is handling vaccine distribution. She is explaining the issues that we are now seeing with this rollout. Harriet.
Okay, let's just start by being honest. Right now, we've got more questions than answers from our state health department. I count our vaccine list every day, and today, 14 counties reporting more than 10,000 cases are running low or running out of vaccine supply. So what is our health department doing to ensure that we've got enough? The numbers are grim and bleak. 670,000 total COVID cases for Tennessee, with 14 counties reporting between 10 and 74,000 cases. Those 14 counties all reporting limited vaccine availability except Hamilton County with 33,000 cases, yet no vaccine.
The scale of the logistics of this are such that glitches and hiccups were bound to happen, as they have happened, and more are probably going to happen.
Concerning, says Raquel Davis, an essential worker who wants the vaccine but has moved further down the priority list as vaccine reserves run short.
When I come home, I spray myself with Lysol, spray all my clothes and everything that I have on. I spray it with Lysol.
Not only does the delay bother her, but concern of availability of the vaccine to ensure the second dose does as well.
But the vaccine rollout in the United States has been a dismal failure thus far. The honest truth is this. Things will get worse before they get better. I told you I'll always level with you.
President-elect Joe Biden today promising to ramp up vaccine supply and distribution in his first 100 days. But what about right now? Oregon's state health director saying she got word last night from Operation Warp Speed that states will not receive vaccine shipments next week. So what does that mean for Tennessee? I asked the state health department, governor's office, and the U.S. Department of Health, is this true? I also asked the state health department if they can guarantee a second dose, and when they get more vaccines, which counties get priority. I got no responses to any of those questions.
In the meantime, hope is on the way. Vaccines are coming, but it's going to be a few months before we all get vaccinated. So let's continue to do our part to keep the virus in check.
Moving forward, the plan is to send new shipment orders to pharmacies so that they can administer the vaccine. That will mean fewer vaccines available at the health department. But as our local leaders have said, the goal is to just get everyone, as many people as possible, vaccinated.
Fox 17 News continuing to follow a couple of other stories for you. And right now we have thousands of Tennesseans who want to know when they might be able to take the COVID-19 vaccine. And that includes teachers who were recently moved up on the priority list. Fox 17 News' Justin McFarland is live this morning to tell us why moving up on this list doesn't seem to be doing any good right now. Justin?
Yeah, good morning. And quite frankly, Jen, a lot of the school leadership sounds a little frustrated. We're live right outside of a high school here in East Nashville that hasn't seen a student in the door all year long. Metro School says they were hoping that when they got moved up the priority list by the state, that would mean that staff could get the vaccine pretty fast. However, they found out recently they could still be months away, and they were hoping for a little better.
While teachers and K-12 staff have been moved up into the 1B phase of the vaccination program, we are still at 1A2 with a significant backlog of those who qualify to receive the vaccine. At this point, the plans released by the state indicate that it will not be until at least February and more likely March before we move into phase 1B.
So who's ahead of them on the list? We're going to be telling you more about that coming up here in the next 30 minutes or so. And we'll be telling you exactly the metrics that they're looking at to see when they can allow students back in the classroom. Right now, it doesn't sound like they're very close.
And as the Tennessee legislature starts its 2021 session, that is, pastors are calling on lawmakers to do more to manage the coronavirus to save more lives. The newest White House coronavirus task force report shows Tennessee now has the third highest COVID-19 infection rate in the United States, facing what they call unyielding spread. At least 5 pastors from across Tennessee say Governor Lee's policies fall short, so they want legislators to demand a statewide mask mandate, make sure schools and teachers have better resources, and stop the spread of misinformation.
We call on the state legislature to take responsibility for doing the job Governor Lee has refused. Intervene, protect Tennesseans doing their part to protect others, but who are now getting hurt, sick, and hospitalized. And you can start by loving your neighbor as yourself by wearing a mask.
Pastors also called out legislators who aren't wearing a mask at the Capitol, asking them to model better behavior to save lives and to stop using masks as a political football.